Good morning and welcome to Medicare Basics, sponsored by Hoag Hospital and the Hoag Medical Group. The Hoag Medical Group is an excellent team of doctors that provide internal medicine, doctors, osteopath, internal medicine, and they have an excellent team of specialists who treat all of your needs. My name is Derek Tarvin, and I've had the honor and privilege of working with Hoag Hospital as an outside insurance consultant for over 27 years. We have a family business and an office in Costa Mesa, and we counsel everybody on Medicare options, the different Medicare plan choices, the Part D drug coverages, and we represent all different plans and companies, and we can compare your current coverage to what is on for Medicare. Today, we'll be going over what is Medicare, enrolling in Medicare, the two main choices for Medicare plan coverage, which can be a Medicare Advantage HMO or Medicare Advantage PPO, a Medicare Supplement or Medigap plans we'll be going over also, the Part D prescription drug coverage, the Medicare Part D, extra help, and various enrollment timeframes. So what is Medicare? Medicare, also called Original Medicare, is health insurance for persons that are age 65 or older, or any under age 65 that have received disability benefits for 24 months, and also any age person that has end-stage renal disease or Lou Gehrig's disease. Medicare has four different parts. Part A is your inpatient services. Part B of Medicare covers all your medical and outpatient services. Part C of Medicare is considered the Medicare Advantage or Medicare HMO or Medicare Advantage PPO. And Part D is where the prescription drug coverage falls under. Only Medicare Parts A and Parts B will ever appear on your red, white, and blue Medicare card. And there's a picture on the screen, an example of what you'll receive once you enroll. So Part A of Medicare, this is where all your inpatient hospital and inpatient services fall under. Most people do not pay a premium for Part A of Medicare. It was actually paid by you or a spouse through payroll taxes while working. And it helps cover inpatient care in hospitals, skilled level nursing care, and nursing facilities, hospice, and very limited part-time medically necessary home health care. Part B, this is all your medical and outpatient services where it falls under. Most people do pay a premium for Part B of Medicare. The standard premium this year for Part B of Medicare is $170 per month, and it can be more depending on your income. The premium for Part B of Medicare is deducted automatically from your Social Security if you're receiving it. If you're not receiving Social Security, you'll receive a quarterly bill by mail to pay your Part B premiums until if and when you start drawing Social Security, and at that time it'll automatically deduct it monthly automatically. Part B of Medicare helps cover medically necessary doctor services, outpatient care, tests, durable medical equipment, limited home health care, preventive services, and more. Again, the Part B of Medicare can be higher than the standard premium of $170.10 per month. They determine your Medicare premiums based upon your income on your tax returns. And Social Security always looks back 2 years at your modified adjusted gross. And those that are filing an individual tax return 2 years ago and your income is less than $91,000, or those that file a joint tax return and it's less than $182,000 will pay the standard premium of $170.10 per month. But if it's higher than that 2 years ago, and they base it on what they call an income-related monthly adjustment amount, or IRMA, the acronym, you will pay more for your Part B of Medicare. And the different premiums that you can pay for your Medicare Part B are on your screen, and they can go as high as this. Social Security, they audit it every single year, so your Medicare premiums can go up or down based upon your tax returns. And since they're looking back 2 years ago, the year 22 looks your 20 tax return, the year 23 looks your 21 tax return, and so forth. If your current income goes down and they're basing it on 2 years ago and they're charging you more for IRMA, give Social Security a call and discuss your current financial status with them, and they most likely will lower your Medicare premiums based on your current status. Otherwise, they audit it every year and it can go up or down based upon your filings. So enrolling into Medicare. Medicare usually starts on the first day of the month that you turn age 65. Unless your birthday falls on the 1st, then they actually backdated a month. If you are receiving Social Security or railroad retirement benefits, You'll automatically get your Medicare card in the mail 3 months before you turn 65 or the 25th month of receiving disability benefits. If you're in these certain circumstances and you do not receive your card in the mail, go ahead and give Social Security a call. The number is on your screen. It's usually better to call your local Social Security office. It's usually easier to get through to, and they're usually very friendly, very helpful, and very knowledgeable. If you're not receiving Social Security or regular retirement benefits, you actually must enroll yourself with Social Security to get your Medicare card. And there's a couple ways you can do that. You can call Social Security, and they'll enroll you over the phone. They don't really have very many in-person appointments anymore. For certain circumstances they do, but it's very limited. Or you can enroll online. You can go to ssa.gov. It's on the bottom of your screen. On their homepage, click Enroll into Medicare. That'll take you to another screen. Scroll down, hit Apply for Medicare Only, and follow the steps. It's pretty straightforward. It takes about 10 or 15 minutes. If you have any questions, feel free to give them a call. And again, they're very helpful, very friendly, and very knowledgeable. There is an initial enrollment period to enroll into Medicare. You may enroll into Medicare 3 months before it turns to age 65, your birthday month, and up to 3 months after your birthday month. If you enroll within 3 months before your birthday month, Medicare will start on the first day of your birthday month. If you enroll during your birthday month or within 3 months after your birthday month, Medicare will start 1 to 3 months after signing up. If you miss the initial enrollment period, there is a general enrollment period every year to enroll into Medicare, and this occurs every January 1st to March 31st. And coverage will start July 1st, and you may incur a late enrollment penalty. There are other circumstances to enroll into Medicare for special purposes. If you're covered by an employer-sponsored group health plan, and it is based on current employment, with 20 or more employees, you actually can delay enrollment for Medicare Parts A and or Part B with no penalty. However, when employment or group coverage ends, whichever happens first, you have 8 months to enroll for Medicare Parts A and or Part B with no penalty. So if you're working or you're the spouse, the dependent covered under your spouse's insurance, they're working or you're working, and there's more than 20 employees covered by the group health coverage, you can delay Medicare Parts A and or Part B with no penalty. And again, whichever happens first, employment ends or group coverage ends, you have 8 months to enroll for Medicare Parts A and Part B with no penalty. Typically, if there's less than 20 employees, you're covered under group insurance, or your dependent is covered, or you're the dependent covered under the insurance. Usually Medicare becomes primary, and you do need to enroll into Parts A and Parts B. But the rule of thumb is if you're covered by employer-sponsored health coverage and there's 20 more employees, you can delay Medicare Parts A and or Part B. If there's less than 20 employees still working, cover the group insurance, typically Medicare becomes primary, and you do need to enroll into Medicare Parts A and Parts B. And always check with your benefits advisor or human resources to see how Medicare coordinates with your group insurance. Oftentimes, those that have more than 20 employees actively working, covered by group insurance, will enroll into Part A of Medicare and delay Part B because there's no premium typically for Part A of Medicare. And they delay Part B because you'd be paying for Part B premiums for no reason. So if you delay Medicare Parts A and B, but there's more than 20 employees, just go ahead and enroll in the future. But if there's less than 20 employees, go ahead and enroll into Medicare Parts A and Parts B. The next slide here, if you have Medicare Part A only and want to enroll into Part B of Medicare, there's 2 forms that need to be filled out. One you'll fill out, one you and your employer fill out, and you submit those to Social Security, and they enroll into Part B of Medicare when such time is necessary. So if you're working, covered by group insurance, and there's more than 20 employees, and you enroll into Part A of Medicare, and then in the future need to enroll into Part B of Medicare, there's 2 forms that need to be filled out. One you fill out, one your employer fill out, and you submit those to Social Security, and they enroll into Part B of Medicare. And you will not receive a penalty, and you can enroll anytime during the year. Those that have a health savings account contribution by the employer and you're covered under group insurance, more than 20 employees, and eligible for Medicare, oftentimes may want to delay Parts A and or Part B. This is usually the only time that one may not enroll in a Part A if there's a health savings account contribution, and it can have an effect on your tax returns. So if you're covered by group insurance and there's a health savings account contribution by your employer, check with your benefits advisor or human resource to see how enrolling in a Part A may affect your taxes. But if there's no health savings account contribution and you're still working, eligible for Medicare, more than 20 employees, covered in the group insurance, you can go ahead and enroll in a Part A, and there's no reason not to. Those that are covered by COBRA, Union, or Retiree Plan, or VA, after employment ends, you have 8 months to sign up for Medicare Part A and Part B with no penalty. So if you're covered by COBRA, which is an extension of your group insurance, once employment ends, a union or retiree plan, you've got 8 months to enroll into Medicare Part A and or Part B of Medicare, because employment has ended even though you're covered under the group insurance, and you want to make sure that you enroll into Medicare Parts A and Parts B if you're under these three circumstances. COBRA can run a period of 18 months to 36 months. And if you're offered COBRA, it's a good idea to compare what the premium is for COBRA and the benefits and compare that to individual Medicare plans, because COBRA can be very expensive. And if you're Medicare eligible, you will need to enroll into Medicare regardless within 8 months of your employment ending, so you don't get a penalty. If you're covered by the VA and you become Medicare eligible, you will need to enroll into Medicare A and B during your initial enrollment period, 3 months before you turn 65, the month of, or 3 months after, to avoid any penalty. So again, if you're covered under VA insurance and you become Medicare eligible, make sure you enroll into Medicare Parts A and Part B, even if you're going to stay on the VA coverage only, because enrolling into Medicare later on, you may incur a late enrollment penalty. So go ahead and enroll into Medicare Parts A and Parts B if you have VA coverage and become eligible for Medicare. So now we're going to talk about the two main plan choices for Medicare coverage. Initially, we're talking about the Medicare Advantage plans, which can be a Medicare Advantage HMO or Medicare Advantage PPO. With the Medicare Advantage HMOs, typically here in Orange County, there's a zero premium. With the Advantage PPOs, two of them have a pretty sizable premium, and there's a new plan that has a very reasonable premium for a Medicare Advantage PPO. They do include the Part D drug coverage into the Medicare Advantage plans. You typically do not need a separate policy. It's all encompassing the medical and the drug coverage. The other type of coverage we're going to talk about a little bit more in the presentation is the Medicare Supplement Gap plans. And with the Medicare Supplement Gap plans, you pay a monthly premium, and the Part D drug coverage is separate, and you must purchase a standalone Part D drug plan. For either any type of Medicare Advantage HMO or PPO or Medicare Supplement plan, you must be enrolled in Medicare Parts A and Part B and paying your Part B premiums. So the Medicare Advantage HMO or Medicare Advantage PPO, they are known as Medicare Part C. Medicare Advantage plans combine Medicare Parts A and Part B and the Part D drug coverage into one plan. Most plans include extra coverage like vision and hearing. And dental, some plans have it embedded, and most all of them do have an optional dental plan that you can purchase if it's not included already. Each Medicare Advantage plan has different costs, co-payments, co-insurances, and out-of-pocket yearly maximums, and the drug coverage. Prior authorization is required for certain procedures, and the plans provide worldwide coverage for emergency and urgent needed services. And the benefits for the Advantage plans can change every single year. The Medicare Advantage HMO plans, you must get your care from the plan's network of providers and hospitals except for emergency or urgent situations. With the Medicare Advantage plans, you select a hospital, a medical group, and a primary care physician from the plan's network of providers in your service area. and referrals are required with the Medicare Advantage HMOs to see specialists. So with the Medicare Advantage HMOs, the insurance companies like the umbrellas, they provide the medical benefits. And there's many, many different medical groups that contract with the Advantage plans. And depending on what medical group you choose your primary doctor from dictates what doctors and hospitals you have access to. So to ensure that you receive all your medical services from Hoag physicians, Hoag specialists, and Hoag facilities, make sure you choose your primary doctor from the Hoag Medical Group. And that way, again, you'll receive all your services for medical specialists and facilities at Hoag doctors and Hoag facilities only. And with the Medicare Advantage HMOs, you can change your primary doctor or medical group throughout the year. And typically you can change the insurance once a year, which we'll get into more. So the Medicare Advantage HMO plans here in Orange County, most of them have a zero or a very low monthly premium. You must be enrolled in Part A of Medicare and in Part B of Medicare and paying your Part B premium. And then you will have co-payments or co-insurances that you pay for authorized service received from in-network providers or out-of-network providers when authorized. You will pay the full cost for non-authorized services if you self-refer to specialists or outside the medical group without special authorization, except for emergencies and urgent care services. The Part D drug coverage is included in almost every single Medicare Advantage HMO plan here in Orange County. So the Medicare Advantage PPO, this is different than a Medicare Advantage HMO. You will use in-network plan providers or out-of-network plan providers that agree to accept the plan. Referrals are not required to see specialists, and you will pay a monthly premium for the PPO plan. There's three Medicare Advantage PPO plans here in Orange County. Two of them have a pretty sizable premium, and there's a relatively new one that's got a very reasonable and low premium. And with the Medicare Advantage PPOs, you will pay plan deductibles, co-payments, or co-insurance for authorized services received in or out of network. Typically, you will have higher co-payments, possible higher deductibles, and co-insurance out of the network. And the Part D drug coverage is included into the plan, so you do not need to purchase a separate policy for your drug coverage. So as opposed to a Medicare Advantage HMO or Medicare Advantage PPO, now we're going to discuss the Medicare Supplement, also known as Medigap plans. The Medicare Supplements, also known as Medigap, they supplement original Medicare and pay secondary to Medicare. With the Medicare Supplements, also known as Medigap, you can choose any doctor, any specialist, any hospital nationwide that takes Medicare patients. Referrals are not required to see specialists, and prior authorization and approvals are not required. There are 10 standardized Medicare supplement plans that are sold by various insurance companies. And with the Medicare supplements, also known as Medigap plans, different companies charge different premiums for the same standardized Medicare supplement plans. With the Medicare supplement plans, you will pay a monthly premium for the Medicare supplement. You have Part A of Medicare in effect, Part B of Medicare in effect, and paying a separate premium for Part B of Medicare. Unfortunately, the Part D drug coverage is not included with the Medicare supplement plans. You actually must purchase a standalone Part D drug plan, which is a third premium involved. So you have your Medicare A, your Medicare Part B, you pay your Part B Medicare premiums, you have a premium for the various Medicare supplement, and then you have a third premium for a Part D drug plan. The Medicare supplement plans are what they call guaranteed renewable for life. They can never change the benefits of the plan or cancel it other than non-payment of premiums. Just unfortunately, the premiums do go up with attained age. We have this chart here that Hope can email you, or we can email you from our office. It has the various Medicare supplement plans for comparison, what your Medicare A and B benefits are, and on the back of the chart, it has the various enrollment timeframes for Medicare supplements, Medicare Advantage plans, and Part D drug coverage, etc. And it's a nice reference chart. So now we are going to discuss the Medicare Part D prescription drug coverage. The Medicare Part D drug coverage is available to anyone that has Medicare Parts A and or Part B. And Medicare itself does not sell the Part D drug plans. To get enrolled into a Part D drug coverage, you must enroll into a plan that has the coverage. And there are two different ways to get the Medicare Part D drug coverage. One that we mentioned is to buy a standalone Part D drug coverage to go along with your Medicare Supplement gap. And the different Part D drug plans are sold by various Medicare approved companies. There's 25 different Part D drug plans available. The other way to get your Part D drug coverage is enroll into a Medicare Advantage HMO or Medicare Advantage PPO that includes the Medicare Part D prescription drug coverage in the plan. The Medicare Part D has different formularies and drug tiers for all the plans. They have what they call a formulary list where they place the drugs in different tiers. And the Part D drug plans can have 1 through 6 tiers or maybe 1 through 5. Each tier has a different copayment and different coinsurance amounts that you will pay. And not all the Part D drug coverages cover the same medications, and the cost between company to company will vary. The Medicare Part D drug plans, whether it's a standalone Part D drug coverage that you purchase to go all the Medicare Supplement, or those that are integrated into the Advantage plans, all have 4 coverage stages. And this model does not vary. It's just how they cover your medications, and the different costs that you pay do vary from plan to plan. Stage 1 is considered a deductible if the plan does have a deductible. The deductible this year can be as high as $480, and you will pay the full cost of medications, typically not generics, but brand or non-preferred classifications or specialty drugs, until you pay the full $480 out of pocket. And again, some plans do not have a deductible. If you have a deductible or meet the deductible or there's no deductible, then you go into stage 2, which is the initial coverage stage. And you'll pay those co-payments or co-insurance for your drugs, depending what formulary tier it falls under, until the full cost of the drugs exceed $4,430 for all Part D drug plans. So if the full costs of the medications exceed this year $4,430 initial coverage stage, then you go into stage 3, known as the coverage gap or donut hole. And typically in the coverage gap or the donut hole for all Part D drug plans, you will pay 25% of the cost of generic drugs or 25% of the cost of brand drugs until you reach the true out-of-pocket of $7,050. And if the true relative out-of-pocket exceeds $7,050 this year, then you go into the next stage known as the catastrophic stage. And in this stage, this calendar year, you pay $395 for generics, $985 for brand, or 5%, whichever is greater. And that at the end of the year, it all resets and you start back at the beginning. The drug companies send you a monthly statement, and they also send you an annual notice of change each year to inform you of the changes for your existing drug plan for the upcoming year. And the pharmacy keeps a running tab of where you're at in the different stages as well. If you are going to enroll into a Part D drug plan, we highly recommend having us do an analysis or you do one because each Part D drug coverage can vary on how they pay your medications. With the standalone Part D drug plans, as we mentioned, there's 25 different Part D drug plans out there, and they can vary drastically from Plan 1 to Plan 25, how they cover your medications. So we can input them and get a line-by-line itemization of all 25 plans and list them from which plan is least out-of-pocket annually to which is highest. And with the Advantage plans, we can see how they cover your medications too, because one may draw you in versus the medical coverage, but then it may lead us to another plan based on how they cover your medications. So I'm going to go back a couple slides because I know this is kind of a confusing model. So if you're in stage 2, the initial coverage stage, you're paying particularly formulary tier drug costs until the full cost, the retail cost, exceeds $4,430. Then you go into the coverage gap, also known as the donut hole. And then you're paying 25% of the cost of generics or 25% of the cost of brand drugs until what's called the true allowance of out-of-pocket exceeds $7,050. If this number is breached, then you go into stage 4, also known as the catastrophic coverage stage. So what contributes towards the $7,050 is any amount you pay in the deductible. Stage 1 contributes towards the $7,050. Any co-payments you pay in stage 2, initial coverage stage, contribute towards the $7,050. And we're in stage 3, the coverage gap. You're paying 25% of the cost of generics, which contribute towards that figure. And you're paying 25% of the cost of brand drugs, which contribute towards that figure. And when you're in the coverage gap, the other 75% of the cost of brand drugs you're not paying is contributed by the manufacturer towards that $7,050. So the combination of what you pay in stages 1, 2, and 3 and the manufacturer pays in stage 3 for your brand drugs exceeds $7,050. Then you go into the next stage known as the catastrophic coverage stage, and that's very good coverage. And then unfortunately, it all resets January 1 again. So those that are higher Medicare income beneficiaries and pay more for your Part B as in boy of Medicare, unfortunately will pay more for your Part D drug coverage. They shake the trees any way they can. And it's the same limits. They look at your tax return 2 years previously, so the year 22, look at your 20 tax return. And those that are filing individually on your modified adjusted gross is greater than 91, or those that file a joint tax return and your income 2 years ago on your modified adjusted gross is greater than 182, you'll pay that IRMA or income related monthly adjustment amount for your Part B of Medicare as well as your Part D. And what you will pay in addition to any premium for the Part D is on your screen, and it can go as high as this. And again, they audit it every single year. So your premiums for Part B and Part D can vary from year to year. There is a Part D late enrollment penalty. If you delay enrolling into Part D or have a break in continuous drug coverage for 63 days or more and don't have what they call creditable coverage or extra help, when you enroll in a Part D drug plan, a penalty will be added to your Part D premium for life. It's not a huge penalty, it's more of a nuisance, but it can accrue. The penalty is 1% of the national average base premium multiplied by the number of uncovered months. So for instance, if you went 24 months without having creditable coverage and you enroll in the Part D drug plan, the standard national average base premium is around $35. So $24 of 35, or 24% is around $8.40. That will be tacked on to your monthly premium for life. So it's a good idea to enroll in a Part D drug coverage. If you have a supplement and you're not taking medications, we just recommend the lower cost premium plans. So you have the drug coverage in case you need it. Don't get penalized for enrolling late. And most of the Advantage plans have the drug coverage in it already. There is a program called Extra Help. It is a Medicare program that helps people with limited income and resources pay Medicare drug costs, also called limited income subsidy. It can help pay monthly plan premiums, deductibles, co-insurance, and co-payments. If you think you qualify, give Social Security a call and discuss your current status with them. So now we're going to discuss the various enrollment timeframes for the plans. There is initial election period, turning 65 or new to Medicare. There is a special election period based on current different scenarios, such as leaving employer-sponsored group health coverage, permanent move, a 12-month trial basis, the annual election period, which occurs every October 15th through December 7th. This applies to existing Medicare Advantage and Part D drug plans only. And there is a Medicare Advantage open enrollment period for existing Medicare Advantage members only. So the initial election period, turning 65 or new to Medicare, and you're thinking about enrolling into a Medicare Supplement or as also known as Medigap. You have guaranteed issue where you have to don't have to answer any health questions for 3 months before your effective date of your Medicare Part B up to 6 months after your Part B effective date. So if you'd like to enroll in Medicare Supplement, you've enrolled in Medicare A and your Part B of Medicare is going into effect. You have 3 months before your Part B goes into effect, up to 6 months after your Part B goes into effect, without having to answer any health questions. It's called a guaranteed issue. Those that would like to enroll into a Medicare Advantage plan, turning 65 or new to Medicare, you may enroll 3 months before, up to 3 months after the month you turn age 65 with no health questions. And those that are enrolling into a Part D drug plan, you can enroll 3 months before, up to 3 months after your Medicare Part A and or Part B goes into effect. And there are no health questions. And the Part D selection allowed during IEP, this is what this is referring to, becoming new to Part A and or Part B, you have 3 months before or 3 months after your Medicare Part A and or Part B effective date, whichever is first. And there are no health questions for the Advantage plans or the Part D drug plans ever. The special election periods, leaving employer-sponsored group health coverage, and you're enrolling into a Medicare Supplement plan or Medigap, you have guaranteed issue, no health questions for 63 days after your group coverage ends, or 6 months if you're new to Part B. Most people are going to coordinate your individual insurance to start the day after your group insurance terminates, but if you happen to miss that, you do have this window of guaranteed issue for the Medicare supplements. And as always, to be enrolled into a Medicare supplement plan, you must have Medicare Parts A and Part B, not or. You must have Medicare Part A and Part B. Those that are leaving the employer-sponsored group health coverage and you'd like to enroll into Medicare Advantage HMO or Medicare Advantage PPO, instead of 63 days, you have 2 months. And to be eligible to enroll into a Medicare Advantage HMO or PPO, you must have Medicare Parts A and or Part B, and you have 2 months after your group of coverage ends to enroll into a Medicare Advantage plan. Those that would like to enroll into a Part D drug coverage after your group coverage ends, you have 2 months after your group plan ends to enroll into a Part D drug plan. There is a 12-month trial right if you enroll into a Medicare Advantage plan when first eligible for Medicare at age 65. You have 12 months to try the Medicare Advantage HMO or Medicare Advantage PPO. If you're not happy with the Medicare Advantage plan, anytime during the 12 months of being new to Medicare, turn age 65, you can terminate the Medicare Advantage plan any month and enroll into a Medicare supplement and a Part D drug plan with no health questions. Those that have an existing Medicare supplement plan, or Medigap as they're called, and enroll into a Medicare Advantage plan for the very first time, you can try the Advantage plan out for 12 months. And if you're not happy with the Advantage plan, or you simply want to get your Medicare supplement back for whatever reason, you can disenroll from the Medicare Advantage plan anytime during the initial year and get your Medicare supplement back and a drug plan with no health questions. Unfortunately, they don't give you both 12-month trial bases. They give you one or the other, but it's nice that they do that. There is an annual election period. You've probably seen this advertised, during the fall. And this occurs every October 15th through December 7th. It's the annual election period for Medicare Advantage and Part D drug plans only. The Medicare supplement plans do not apply to this time frame. All Medicare beneficiaries can join, switch, or drop a Medicare Advantage plan or Part D drug plan during this time frame. For the Medicare Advantage plans, you must have Medicare A and B, and the Medicare Part D drug plans, you must have Medicare Part A and or Part B. If a change is made during this time frame, the new plan becomes effective January 1st or cancels January 1. So again, the annual election period occurs every October 15th through December 7th. It's a time frame you can enroll, disenroll, or switch a Medicare Advantage HMO, PPO, or a Part D drug plan only. There is one other enrollment scenario for the Medicare supplements. It's not on your screen, and for the Advantage plans as well. If you move out of your county or to a different state, you've got guaranteed issue for whatever plan is offered in that area, whether it's a Medicare supplement or a Medicare Advantage plan and a Part D drug coverage. So if you do move out of the county or a different state, you have an opportunity to change regardless of health to whatever plan is offered in that area. So this is a relatively newer enrollment period. This is the Medicare Advantage open enrollment period. And this is an open enrollment period for Medicare Advantage plan members only that occurs every January 1st through March 31st. If you're enrolled in a Medicare Advantage plan, you can actually switch to a different Medicare Advantage plan during this time frame. Nobody really knows about this time frame because they can't advertise it or target anybody. But if you have an Advantage plan and maybe you didn't review your drug coverage and you go to the pharmacy in January or February and your medication is not covered or it's an exorbitant price, you can actually change your Medicare Advantage plan once during this time frame. If you change your Advantage plan in January to a different one, the new plan becomes effective February. If the change is made in February, it becomes effective March, and March becomes effective April. Or you can actually disenroll from the Medicare Advantage plan, return back to original Medicare, Parts A and Parts B, and enroll into a Medicare Part D drug plan and apply for a Medicare Supplement plan. If you're going to use this time frame to go back on to original Medicare and enroll or apply and try to enroll into a Medicare Supplement plan, we highly advise applying for the Medicare Supplement plan first because they may turn you down based on health, depending on your certain situation. And if you enroll in the Part D drug plan, it automatically cancels your Advantage plan the next month, and we don't ever want to leave anybody out of health insurance. So if you have a Medicare Advantage plan, you want to return to original Medicare during this open enrollment period, make sure you apply for the Medicare Supplement plan first and that they accept you before enrolling to a Part D drug plan. Because again, enrolling into a Part D drug plan will automatically cancel your Advantage plan out the following month, and we do not want to leave anybody out with health insurance. I know we went over a lot of information. I will be taking questions now. You can always contact me in our office. We'd love to hear from you. We don't ever charge a fee for consultation. We usually schedule 2 hours for an appointment because there's a lot of information to go over. And we may have some questions now. If not, we'd love to hear from you. And have a wonderful weekend.